As we mentioned earlier, although many are still in summer free-for-all mode, COVID cases are on the rise, up for the fourth day in a row in all 50 states. Deaths are up nearly 25% from 2 weeks ago, especially in states where vaccination rates are frighteningly low. So where are we headed? To two Americas? And will the new masking recommendations for schools from the American Academy of Pediatrics be enough to keep unvaccinated kids safe? I'm joined by Dr. David Hamer. He's professor of global health and medicine at BU's School of Public Health. He's also an attending physician at Boston Medical Center. Dr. Shira Doron is a hospital epidemiologist at Tufts Medical Center, professor of medicine at Tufts University. Doctor, good to see you both. Thanks for being here.
You too.
Dr. Doron, thank you. If I can start with you, I just spoke to the town manager of Provincetown where they have a cluster, taking some precautions. Is Provincetown a sign of the times, even in the second most highly vaccinated state like Massachusetts, or do we have nothing to worry about here by what the president now calls a pandemic of the unvaccinated?
Well, I hope it's not a sign of the times. And I wouldn't say we have nothing to worry about. We have to understand better what exactly happened in Provincetown. I think we will learn a lot from this. I hope that what we will see is that vaccinated people who were infected as part of this cluster remain mildly ill.
But they're unvaccinated people too, Dr. Kramer there. And again, the numbers aren't huge, but they're increasing. Are we virtually immune? I don't mean that well, I guess I do mean it in a medical sense from what's happening in much of the rest of the country?
I would say no. I mean, there's a lot of movement of people. We're in summer season. People are visiting Massachusetts from many other parts of the country. And, the risk of movement of unvaccinated people and infected people into the state is substantial right now. And there are many pockets of basically outbreaks among unvaccinated people in different parts of the country. It sounds like Florida in particular has been hit fairly hard recently. And so there's a risk here for that to happen as well. If we were able to block all the borders of the state and prevent anybody from coming in, it'd be one story, but that's not the situation.
Well, Dr. Hamer, it seems to me that regardless of blocking borders or not, there are two Americas. We usually meant it in a sense of inequity socially and economically. Now it seems in terms of health. In addition to Florida, we know that some hospitals overwhelmed in Missouri. Vaccination rates, places like Alabama and Arkansas are in the 30% range. Did much of America open prematurely, Dr. Hamer?
I would be concerned about that. Yes. I mean, some of it didn't even fully close, honestly. I mean, parts of the South, were sort of relatively resistant to preventing social gatherings, to indoor mask use, and to other measures that were more strictly applied in other parts of the country, in the Northeast, parts of the coastal, like Northwest. So I think, that's part of the problem, but I also think that, there's a much greater proportion of unvaccinated or only partially vaccinated adults and adolescents in many of those areas.
Dr. Doron, generally, and I know this comes off really crassly, but I think it's true, Americans, and I guess many people do, worry about themselves, and then there's the rest of the world, whatever it means. And we know how dire circumstances are in so much of the rest of the world. But staying within our country, how long can a country from a public health perspective continue where there are literally two Americas, one wildly unvaccinated, where there will, I assume, continue to be some surges, if not worse, and places like New England that have done the responsible thing and taken care of themselves?
Yeah, it's so unfortunate. I mean, we don't want to see any Americans or any citizens of the world get sick. And really, with this Delta variant being so incredibly contagious, that changes the calculation in terms of when we can expect to see that herd immunity, that elusive herd immunity. We don't know what percentage of the population needs to be immune to get there, but it's going to be very high. Eventually, though, whether it's through vaccination or infection, we will get there.
Well, if the goal, though, Doctor, staying with you, is vaccination rather than infection, essentially the number of vaccinations has plateaued virtually all around the country. These incentives for the most part, things like even lotteries with million-dollar jackpots. We don't know what's going to happen here, but we know places like Ohio didn't work terribly well. What does one do to get people moving who have decided that they're perfectly fine as they are, Dr. Doron?
Anything we can, one person at a time, whether it's education or whether it's increasing the convenience. And many people believe that when the full FDA approval comes out, that could create a bump in vaccination. And that would be great.
And part of the reason there is because some argue there's a legal obstacle to mandating a vaccination under emergency use authorization. But Dr. Hamer, if I can talk to you about that for a second, I have to say I think people viewing, I'm a big mandating kind of guy when it comes to vaccinations. When I just spoke to Alex Morse, the town manager of Provincetown, he said to get in a crowded venue, you must show proof of vaccination. In a country that was skeptical, France, the president, Macron, did a 180 and basically said, you want to get into every kind of place you like, cafes, theaters, etc., you must be vaccinated. Is there any other route to herd immunity other than some level of mandatory vaccination, whether it's from the private sector or governmental jurisdictions?
I think, well, I mean, I think there may be other ways, through sort of, but they may take much longer for us to get there. And that is really, word of mouth, making vaccine more accessible, trying to overcome concerns and misinformation about the vaccine side effects, and eventually getting to the point where we have a vaccine available for children, 11 years and younger. But honestly, I think, these mandates, and actually just today, Boston University announced that we're going to make it mandatory for faculty and staff in addition to students.
Good.
And I think a number of universities have gone that direction because it just voluntarily, people are not doing it quickly enough to get us to that point.
Dr. Hamer, staying with you, the American Academy of Pediatrics, I mentioned, recommended this morning that all students older than 2 years old, vaccinated or not, wear masks in class. Are they right about that?
I think it's a good idea for now. I mean, the variant, the Delta variant, as Dr. Doron said, is extremely contagious, very easily transmissible from person to person. It's primarily through airborne transmission, and having masks is one of our best tools. That and improved ventilation systems, or just being outdoors, which is not necessarily practical for schools, but all of those will help to decrease transmission. And there are breakthrough, the vaccines are not perfect. So some people are getting infected despite vaccination, although those rates are much, much lower than people who have not been vaccinated. So even people who have been vaccinated should wear masks for their own protection.
Well, let's stay on that. That was actually my next question to you, Dr. Doron. During this, what we hope is a transitional period, despite very high vaccination rates. In the Washington Post this morning, Massachusetts is second in the country. All the New England states are way up there. Would you advise everybody to be wearing masks until?
I do not.
You do not? Why?
Yeah, I do not, because I believe that the data are showing that the vaccines are still very, very effective, even against the Delta variant. And I think that we have moved into a place where personal choice is really what should drive behavior. And some people, as they should, feel very protected by their vaccine and are okay with the possibility of getting mild illness for the purpose of getting back to their pre-pandemic life. And other people are more risk averse and should wear a mask even if they're fully vaccinated in a crowded indoor space.
Are you saying that because you don't think they should wear masks, or I don't mean to question your motives, or because you're worried that if you urge them to wear masks, the unvaccinated are going to think that getting vaccinated doesn't do much for them? It's the latter, isn't it?
No, I'm saying that because I believe that the science suggests that one doesn't need to wear a mask to be safe if one is fully vaccinated.
Okay, we only have a minute left. As you know, the Olympics start this week. You've been reading and hearing as much as we have about major, not major outbreaks, but athletes who are there who are major players, including obviously a young tennis player, Coco Gauff, will not be participating, and some others. Dr. Doron, quickly with you, should these Olympics have gone on? Do they have super spreader potential?
Well, I mean, I think certainly there are ways to bring people together safely without the spread of COVID-19, and a lot of testing is part of that, and of course, vaccination is part of that. So they do need to be on top of the situation and keeping close tabs.
Did they make a mistake, Dr. Hamer? As you know, the vast majority of people in Japan did not want this to happen. The International Olympic Committee wanted it to happen.
I mean, I think it's unfortunate that I think there's a lot of pressure, a lot of organization, also a lot of money behind the Olympics, and so there was a sort of pressure to make them happen, despite the local sort of the feelings of the local people, which I think is unfortunate. But I agree with Dr. Doron.
Dr. Hamer, Dr.
Yes.
Doron, I appreciate your time, both of you. Be well. Thanks.
Okay,
Yeah.
great. Okay.